Welcome to EVMS Ultrasound Bytes. I'm Dr. Craig Goodmurphy, and today we'll be talking a little bit about machine and mechanics, especially as it relates to some of the artifacts we'll be using and seeing in some of our early phantom trainers, what we call our phantoms. So some of our objectives that we're going to have for today are going to include some of the important knobs that you'll need to get familiar with. And even though they're on a few of our machines in different locations, no matter which machine you go to, you'll want to look for these key buttons and knobs. We'll talk a little bit about how to set up a machine and make some adjustments to it. Then we'll look at common artifacts by doing some scanning of our phantoms. And then we'll look at how those would apply in a clinical situation before we end off with a couple things on some pitfalls you want to avoid and some pearls that can help you along the way. And then we'll go to our sonographic physics and instrumentation snapshots, which will be a series of things we'll look at, trying to pull you a little bit closer to some of the SPI examinations that you'll want to work towards in our badging system. Here we can see an important shot of our Mindray keyboard. And we're going to go over a few of the important knobs that you'll be finding while we do that. Let's go to a live shot of an overhead keyboard of our Mindray. So first things we're going to want to set up is there's a standard scanning protocol. First, you make sure that your patient is who they say they are by checking their band. Then you're going to set up a scan by pushing patient information. And let's look at what happens to our screen when we press that. Now you can see that you'll enter some information, and some common things that you'll be putting in here are a label for the session that we're in. Now, other than the actual patient's name, we're going to put in machine basics for this lab, but it may be a parasternal long axis lab, it may be a gallbladder and liver lab. You'll want to put that in the patient's last name section. Over in the first name section, we'll want you to put your program. So if you're in the MD program and which module you're in, perhaps it's going to be MD 102 for anatomy, or maybe you're going to be in the health professions programs and you'll want to either put Med Masters or PA and then the graduating year. Then you'll come down to the OK button and we'll go back to our overhead where we can see the Set button. That Set button is right here. This behaves like a cursor. When you want to set it and forget it, click the Set button. You can also double click it to get certain functions on the screen as well, like calling up a saved image or a saved video clip. So we'll set our button, and now we'll go back to live scanning where we can see that we've got some information on some of the menus over here. We can see the type of probe that's actively set up right now, as long as it's not frozen, right here. And this is showing us that it's a linear probe, that we're going to have a straight across image. If we look at one of these saved images, and I'll double click this Set button to call that up, we can see from the picture that this was done on a curvilinear probe. And it looks like a piece of pie with a bite taken out of the apex in the near field. And this would tell us what kind of probe this was set on. If we go back to our screenshot of the overhead, some of the things that we can do to get back to live scanning would be to hit this B mode button right here. And that will take us back to our B mode of the live scan here. Sometimes the freeze button will be useful for that as well, to take you back from a frozen screen to an unfrozen screen. When you're changing your probe, it is very important to remember this freeze button, because this will take the energy out of the probe that's connected to the machine, so that when you're uncoupling them, you won't fry the probe by having an electrical spark jumping as you get that locked in phase of the probe getting away from the machine. Now, a couple of the other buttons that we're going to use very commonly. We've already seen our patient button for setting up a scan. When you've got that all set up, now we want to gather information about the patient. And that's going to involve us to use our presets or our exam button. On this particular machine, it's called exam, and when we press that button, we can see that it brings up a list of things that we have set up as a list of tasks to be done. This is not a complete list at all. However, if you wanted to add new exam presets, you could come down here and press your Set button, and it would make a long list of opportunities or options for you to scan through. And you can see all of these various components. If you wanted to move one of them over, you could hover over it, set it, and then move it into your existing list. So that gives you lots of options. Once you're happy with what you're going to accomplish, you press OK. And then you may need to come back into your exam settings in order to select them. So here we can see that for this particular one, we want to do MSK, which is known as musculoskeletal scanning. I like this one because it gives me a really nice bright gain. It will set the depth to being very low or shallow scanning, since we're using a linear probe. And by selecting that, you'll see that it's changed on the screen to MSK. Now it's got a very wide field of view. It's got a brightness and contrast, or a brightness setting that will be beneficial. And now we can start to see, if we go back to the machine itself, here is a picture of that linear probe. This linear probe is going to have multiple bandwidths through it, so it goes from 12 megahertz through a region of 4 megahertz. The highest number is usually to the left, and the lowest number is usually to the right. This means it has a broad bandwidth. You can see a probe marker, which typically on all the machines would be something a sonographer could feel in the dark. Remember, they're scanning in dark rooms many times, and you want to be able to feel the probe marker. It can sometimes have other things on the other side, which might be for probe guidance options. And we're going to have our overhead views as we pull down to our scanning here. We're now going to start looking at our phantoms that we've built for you. And we have two basic phantoms here. We have a round, smaller phantom, and we have a deeper square phantom, but they have a lot of the same types of components in them, although it may be good to look at multiples of them. We've tried to put many of the things that you would find as projectiles inside somebody's body into these. So we have hard rubber, we have soft rubber, we have hard metals, soft metals, wood, and we even have glass, or even natural objects like you can see in this one right here, a starfish. And these will behave and have echogenic properties that will be very similar to various components of the body itself. Let's zoom in on this particular one right now. Now that starfish that we can see and the bullet that we can see are two things that we would want to get a good look at. Let's scan the bullet, because we know that those end up inside of people. When we put our probe on, we're going to put that the right of your screen that you're looking at is towards the patient's head, and then away from you, or towards me, would be the patient's right. And that's because our pillow is up this way, and I am back this way. So the two conventions, probe marker towards the head of the patient, or probe marker to the right. As we scan this bullet, we can fan through by anchoring our midpoint. We can pivot by anchoring our midpoint. And we can scan it through it itself by going cranial or caudally in the short axis, or we can scan across it in the long axis. Remember, there's different anatomies to think about, and this can make it confusing when we're articulating what we're trying to say or mean when it comes to ultrasound. We have the orientation of the patient towards the head of the bed or towards the right side of the patient, but if you think of this bullet as an organ, let's say a gallbladder, it will also have its own anatomy and orientation. So are you talking about the orientation of the patient? Or are you talking about the orientation of the organ? Or are you talking about the orientation of the probe? Or are you talking about the orientation of the screen itself? And we have to get used to all of these different orientations and how we talk about each one. So, if we're looking at the bullet with the patient's head this way, to scan the bullet in the long axis, I would not be quite in the long axis of the bullet. I would have to pivot a little bit to get the long axis of the bullet itself. Let's go to the screen for a second. If we look at what our ultrasound screen is going, if I put a little gel on this, and then I put it over top of the bullet towards the patient's long axis, I can see that I'm not fully around the long axis of the bullet itself. To do that, I would have to pivot slightly. And now, with pulling up my cursor, I can see here's the tip of the bullet, which is closer to the surface that's at the top of the screen, and the base of the bullet, and it's creating an artifact of a reverberation all the way through. The fact that it's such an even echo reverberation through this tells me this is a soft metal. So sound is coming through the gel, hitting the bullet somewhere throughout it, bouncing around, and then heading back to the probe to be picked up. And if it bounces a lot, it ends up putting a white pixel very deep in the image. If it only bounces a little before escaping and going back to the probe, it will put a sound pixel or a white pixel closer to the surface. So we know that the bullet doesn't look like this, but it's partially what we're seeing as artifact. We can also see some air around the bullet, which is creating some types of shadowing as well. That would be what we would call a dirty shadow. And it may interfere with the edge of the bullet, just like this here, where the sound has been shadowed out because of that air artifact. Now let's work over towards something a little bit softer. We have to change our depth. Where do we change our depth? Let's go to our screen again and look at that. Here we can see depth down and depth up. If I want to go more shallow, I'll hit the up button. If I want to shoot deeper into the image, I'll hit the down button and add depth to it. Let's go back to our screen and see what happens when we do that. In our up arrow, notice how we have about 2 centimeters of depth here, and this would be at a 3 centimeter mark. If I want to shoot more shallow, I hit the up arrow and the numbers get smaller. If I wanted to shoot deeper to get this soft artifact, I can shoot deeper and I'll add depth. This is actually the bottom of the trainer, so we know that our trainer is 4.5 centimeters thick. Now we can see a spiculated mass that would look a lot like something that would be very nasty inside of a body, and we can see that it's having a sound shadow below it, and it has all this stippling around the outside edge of it. This is an echogenic soft rubber artifact or substance, and it looks like a spiculated mass or a tumor inside. Notice how there's a little paddle out to the side. If we spin on it, we can see that it's round because it has the same things in all those various pathways. Now, let's go to scanning that starfish. Can anybody see the starfish? We're scanning it from a superior view. Let's look at our front view camera. Okay, now we can see that we're scanning from a coronal plane right over top of this starfish in order to see the picture that we were just seeing before. And to angle it correctly is a little bit of a mind teaser in that we wouldn't think that scanning it from above would give us a frontal view. But remember, the probe that we're using has both length and depth. So we're actually acquiring width, length, and we're shooting into the gel to get our third dimension of depth, which is what gathers up 3 dimensions of information about this particular object. And that's why we made our phantoms clear, so that you could actually see what you're scanning, and your eyes that are very good at 3D perception of objects, and see what they're looking like on the screen. Let's go back to our live shot and see that coronal scan plane is giving us a frontal view of the particular starfish. And as we scan through it, we could save an image of this by hitting freeze here, and then going to the Save Cine here. Now we've got a video of it. Let's go back to our screen. And notice, if we use our cursor, we have two still images that don't have the little film strip edges. That's how it tells us it's a still image, versus this one, which has the film strip images and tells us that by pushing that half moon above it, the Save Cine, we can actually click that and see the video play. Double click. And now you can see that there's 137 frames playing through this. If you wanted to pick the one that you like the best, you can roll through it. Let's use our trackball for that. Here we can roll through our image. Let's go back to our screen and see what's happening with that. And we could pick the one that gave us the best representation in time. And now we would just hit our Save button, seen here, that would now save a still frame, frame 55. Double click to see it, and now it's a single frame. So those are our common buttons that we're going to use. Let's do them one more time in review. Let's go to our screen or our keyboard shot. And now we can see the common buttons that we'll use. First of all, we've already been introduced to our on and off button. We've been introduced to our time gain compensations that will slide the gain in near field all the way down to far field. We've used our overall gain up and down. We'll be using our freeze and unfreeze button. We'll be using depth more shallow and increasing in depth, going deeper. We're going to be using our frame selector as we roll through, or our trackball to roll through. We'll be using our set button, which will be like our mouse click. We'll get into measuring a little bit later on. You'll definitely want to be able to use your cursor on the screen. Our save button, our exam and our patient setup. Exam is going to be relevant to the presets. And after we're done everything, we want to end our exam. The last couple buttons that we're going to use will be changing menus with these little half moons along the top of the machine. And that will include our Save Cine, our focal point as we change our focal position, and of course we're going to want to make comments. If we want to leave a comment on a picture, we'll hit comment, and if we want to add an arrow, we'll add an arrow. Let's go back to our live screen or our captured image, and we would want to put an arrow to show the rays of the starfish. Perhaps we want to put a comment on that, so we would hit our comment button, and we would bring our cursor to where we wanted to enter our text, and we could say that this was a ray. Notice how it's too far away from our arrow to be of use. We could then hover over top of it so it's green, hit our set button, and move it into position that we're more comfortable with before setting it into that position one more time. Remember, there's no anonymous scanning in ultrasound, so you always put your name, your student ID, and what you're scanning. And this is a coronal scan of a starfish. There's a lot of things that you could scan inside of this particular trainer. We want you to spend some time seeing what glass, wood, metal in various planes look like and describe them to your partner. In this particular one, we can see washers, starfish, wooden biscuit, soft rubber, soft metal of the bullet, and there's even a marble in here which doesn't show up as well in this particular view, and even some BBs in here that end up inside of people, of course, as well. Hopefully this gets you started on using some of the basic knobs and machine knobology. Now let's look at a couple of the artifacts that are created by these particular items. So when we have another machine that we're going to be using a lot is our Logic E. And if we can use our mouse of our computer, we can hover over a couple of the same kinds of buttons even though they're in different locations here. So if you hover over the patient button right here, you can see the time gain compensators right here. You can see the on-off button right here. And instead of the half moon buttons, we have little knobs and dials across the top bars, which are going to have a white central button to change the menu and a dial to go up and down. We're going to come down the side of that left side. We've set up our patient scan, and we're going to see a few other things that we'll use early on as well, like the overall gain, and that's a rotation button. You can see that we can do the B mode right there. And we'll oftentimes use Dopplers of various components here. So we can see color flow and power Dopplers here. We'll get back to some more of those different types of modes that we'll have in another video. Or we have a trackball the same way we do in the Mindray. And we have a cursor the same place we do in the Mindray. Here's our cursor. If we go to the opposite side of that little half moon, we can see our set button. We can see a freeze button. And in the depth changes, it's a knob on this particular machine right here. So you'll just rotate that to increase or decrease the depth. You don't want to press that middle button during this portion because that will take you into the zoom or ellipse components. So you just want to rotate it to change your depth. The one thing that's a little bit confusing on this one is set up for hospital use. And you can see the P1, the P2, and the P3. Think of those as programmable buttons that we can have various functions. In our particular setup, P1 is going to be a save still. If you freeze it and set P1, it's a still. But if you just press P1 while you're scanning, it will save a little video clip. P2 is going to save it to a thumb drive, and P3 will send it to a hooked up printer. So those are going to be a little bit variable from machine to machine, and they could set up based on what you did a lot of. Notice how the presets are going to be on the green bottom left corner of the keyboard. You can see green text. There's presets. That's where you'll go into the GE to change all the presettings of adult abdomen, fast exam, knee, MSK, all of those other components that we saw in the Mindray under patient and exam. Then you have a end exam and report. We've already showed you how to adjust the depth and the overall gain. Let's look a little bit at our time gain compensation. For this one, I'm going to scan the larger gel. We'll start out with putting a little bit of gel onto the probe, or the patient in this case. Remember, we're going to have the head this way, or to the right of the patient into the screen. And I've put this little advanced remote in order to indicate that. If we go back to live scanning, here's our frozen image. Here's our live scan. We can now see a bullet again. This time the bullet is in a transverse plane inside the patient, but because I'm scanning transversely, we actually get a long axis view of the bullet. Here we can see another soft metal. This is actually a BB, and you can see here that it's circular, but it has the same kind of soft metal reverberation artifact going through it as the bullet does. Over here, we actually can see that we have another little substance. This one is behaving as a hard plastic coming down in here. This is actually some 3D print material that we put in here. And then let's go to some glass. Here we can see glass. There it is. This is a little tiny marble, and you can see that it is a little bit more superficial, above 2 centimeters, close to 1.5 or half a centimeter, 1 centimeter deep. So here's 0 at the surface, 1 centimeter, 2 centimeters, where our focal point is. Notice how the focal point is properly set for scanning this glass. And we know a marble is round, but if we scan through it by fanning, we can actually see the center of it because it has this reverberation artifact, and it's the densest here, so we get sound coming through the gel, hitting the surface and bouncing directly back to the probe. But some of it will scan and go through the marble, bounce back and forth, and then escape, and it keeps making these repeating reverberation lines, telling us that this is a much shinier and more reflective object than the soft metal was that we saw in the bullet. If we scan it in 2 planes by pivoting our probe 90 degrees and scanning through it again, we again see it has a center point, which tells us that it's a round object. One last thing we want to scan is we'll go back in and we'll scan another marble. This one, again, is a little bit deeper. It starts at 2 centimeters. And this is one of those classic marbles with the spiral in it. And you can see how it creates the center reverberation as well. And we're getting a lot of sound bouncing off the surface of the curve of the marble. But notice that we can't see the inferior surface. We would have to scan in another plane and see that it's round, even though our eyes understand what a marble looks like very easily. In ultrasound, we're not able to pick up any sound off of here because it's all refracting or reflecting off of the surfaces that we see here. This would scan a lot like some of the bone does, where it absorbs all the sound along the edges and then leaves a shadow underneath. The difference with bone is we oftentimes don't see the reverberation artifact that we get in the center of this marble. Let's go back to our PowerPoint. So we've adjusted some of the things we see. We've talked a little bit about some of the common artifacts, which would include posterior acoustic enhancement. We've looked at some of the clinical applications of these particular things. And we can see here, if we scan over the lung image with the mouse, and we can see here's the rib. That's the edge of it. That's bone. There's the other rib. And then we have the intercostal space where we can see through the muscles. And we're now able to see the pleural line, which is very reflective as a reflective surface of serous parietal peritoneum, or I mean in this case pleura. And then we're seeing reflective lines from that, which is going to be a reverberation artifact. Notice how the deeper it gets, the less amplitude that the sound would have as it gets back to the probe, so it starts attenuating the signal. Those reflective lines are going to be called A lines. We'll talk about some of the artifacts that we'll use as our friends a little bit later on when we scan lungs. If we look at scanning the spleen on one side, we can see a reflective artifact of the mirroring. It looks like there's a spleen deep to the reflective surface of the diaphragm, and there's the real spleen. So if you're aiming for one of these with a needle, you definitely don't want to be aiming for that deep one because it's not real. It's an artifact. And if we look at the gallbladder scan, the third image, you can see that it is a cystic structure, so it's anechoic, but it has some through transmission, which makes the posterior acoustic enhancement underneath of it be much brighter than some of the surrounding tissues, even though they're the same tissues. We also have a big stone inside of this one, a gallbladder stone, And this would be absorptive of the sound at the beginning and therefore create sound shadow underneath. In our next image here, we can see a bladder that's being scanned. It also has some of the posterior acoustic enhancement because it's a cystic structure. And you may have some articulated bowel gas, which would be air artifact around the edges that would create some shadow. And there may even be some edge artifacts, and we're not getting a good example of this one in here. So let's think about some of these. You have to keep adding more and more artifacts. Don't get tied up on just one of them. I know people will love posterior acoustic enhancement because I see it all the time, and that's an okay place to live when you're starting scanning, but don't stay there forever. Now let's do a few pitfalls and pearls. For instance, we don't want you to overset your depth. Your depth changes based on what you're scanning and what your point of clinical interest is. The depth should be set at the bottom of your point of interest. Watch for banding. Use your time gain compensator, those sliders, from superior to inferior to make sure that you have a nice, evenly echogenic structure. But don't take too much gain out because you could be getting rid of real issues. Make sure that you know all of your artifacts and which presets will be the best settings based on your patient's habitus, what your objectives are for your clinical scan, and the type of probe that you'll be using. And if you're new to a machine, make sure you take a quick look for the on-off, the depth adjustments, the TGC or time gain compensators if they're available, which they will not be available on your handheld machines, and your gain adjustments, which will always be available, and your focal point, which may not be available on certain machines, but remember, if it doesn't have a focal point adjustment, your goal is to have it in the sweet spot at the middle of the image based on depth settings. Now let's talk about a specific SPI pearl, and this time we're going to talk about pulse repetition period. Your PRP is basically related to how many pulses you're going to have per unit of time, and it's measured in microseconds. And since the ultrasound machine is both a speaking and a listening device, it has to speak by pulsing out some sound waves. Then it has to listen for that to bounce off of the object and hear all those returning echoes. So you have to wait until you can send out another pulse after those first ones have returned. Therefore, if you have deeper shots, you're going to have less pulses per unit of time as you wait for them to come back from deeper depths of your shot. Therefore, when you go deeper into your shooting, you're going to have a lower spatial or temporal resolution because you've increased your pulse repetition period. It's related to a couple other features of ultrasound that can be adjusted by the machine, which is why it's so important that you understand PRP. If I increase my depth, I increase my PRP. We've just talked about why that is. If I increase my pulse repetition period, I'm going to decrease the pulse repetition frequency, or PRF. These are inversely proportional to one another, such that the pulse repetition frequency is 1 over the pulse repetition period. And that means if I want to fire a sound more, I'm going to get more frequencies, more frequent sampling, and have better resolution. So watch your depth because it affects both your PRF and your PRP. The duty factor is the time on that machines work. If it pulses and then listens, then you're going to have a certain amount of time that it remains on. If it pulses more frequently, then your duty factor will go up. If it's listening more, then your duty factor will go down. And this can be mathematically described in that duty factor is pulse duration over pulse repetition period times 100. So this mathematical equation results in some of the changes to both PRP, PRF, and duty cycle or duty factor as it relates to the adjustments on your screen. So it's very important for the sonologist or the sonographer to understand these principles. Well, that's it for this Sound Bites on ultrasound at EVMS. We're going to see you next time with more about ultrasound and point of care ultrasound training.